From Channel 36.
In beautiful downtown West Hollywood, this is
My
My
WeHo World.
Bye!
We're on here with Heather McKeon, who is an insurance attorney. Help me out here, Heather.
Insurance
Help me
attorney?
out here. Help me out here, babe.
Yeah.
And Dr. Phillip Musikanth, who is an internist HIV specialist.
Very
And
good.
we're answering, am I good? Am I right on all this?
Yes.
Yep.
Welcome. Welcome to Tape 2, everybody. Thanks for staying with me. This is, I think, one of the most important, I think this is the most important My WeGo World. This is like my 120th show, and I don't think anything's been more important than this. I've gotten well over 100 questions, and we're going to continue on with our questions. And Heather appeared in the movie Michael Moore's Sicko. And Phillip has been practicing internal medicine for how long?
25 plus years.
25 plus years. And you're originally from
South Africa.
South area. How'd you wind up over here?
Looking for Nirvana.
Looking for it. Did you find it?
I think so.
You think so? You like it here?
I do.
Have you ever been to Kilimanjaro?
No.
No? You lived in that continent. You know, that's one of my things on my bucket list. To do.
Kilimanjaro.
Yeah. This, you know, they say in another 10 years the snows will be gone. Did you have to learn Hemingway when you were in school, or is that an American thing?
We didn't have to learn it.
You didn't have to learn it. We had it. We had to study it. We had to.
I don't like Hemingway.
Let's move on with our questions. Okay. As you know, I had viewer mail, ask questions, and for these are very important health and concerning insurance and health issues. And the first one is for Heather. We'll let Heather read it, so you know I'm not making this up.
My health insurance company forces me to get all of my prescriptions through mail order. I live in a non-security building and my medications are usually left outside in a package for anyone to see and take. Do I have any recourse?
Toss that question.
Toss that
There you
question.
go. Yeah.
The answer is yes and no.
The answer is yes and no. Why is that?
Most carriers will not force mail order on you if you don't really want it. You may have to pay a little higher on the deductible, but if it's worth it to you to not do mail order.
I can see where this person is coming from because medications today are very personal.
Very personal, especially here in West Hollywood. There are some personal drugs that people are
I
receiving.
think everywhere.
Everywhere, yeah. But what I was getting at is, here in West Hollywood, you have lots of different pharmacies that are able to, what we call compound pharmacies, which means they can actually make the drugs there. They can interact.
They can make the drug up there.
They can interact with your doctor. They can be very personal. You can actually know your pharmacist.
Like a
They can be a real
suppository.
person. A lot of places in this country, that's not the case, just because of rural areas. So mail order is actually very good for them. So it's not something you're going to get rid of, but definitely if you don't want your medication coming from mail order, most carriers will let you get out of it if you tell them what you're going to do and what doctor and what pharmacy you're seeing. And if you work with them, I haven't had a problem getting people out of mail order.
When someone gets a mail order drug, right away everybody's comes to everybody's mind, it's coming from Canada. Is that true?
No.
No.
The mail order, if you're doing it through your insurance company, is not coming from Canada. Although you can get relatively inexpensive, some common drugs from Canada, but that's a totally different issue. Whether that's legal or not is a totally different issue. Mail order through your insurance company, every insurance company have these giant pharmacies that are essentially warehouses for drugs that they mail out to people. And for some people, it's been a bit of a godsend to have mail order
I
pharmacy.
would say, depending on where you live, then, But in this person's case, it's a privacy issue.
Right.
Or somebody could be stealing.
Right. You'd be concerned about theft in a non-secure building. That's a reason usually to get out of mail order. You can.
I have mixed issues on it myself. All right. I mean, it's just I'm not worried about the mailman. It's a matter if it can't fit in my little mailbox thingy and it's sitting on top. What if somebody grabs that drug and I really need that? And now I've got to call back and say, well, someone stole my drugs.
Or a child gets a hold of medication they're not supposed to get a hold of. I mean, there are certain medications that are being sent through mail order that our children should not be playing with. So there are real secure issues, especially if you have other access to the same drug in an easy manner, which you would in a city with lots of compound pharmacies. So the carriers have actually been pretty good on this issue. I rarely say that phrase, but in this particular issue, they seem to be relenting most of the time.
Good answer. Moving on. That's a good question. Next one. I'm going to read this one. I think this one's for Phillip, but Heather, you can chime in. I'm in my late 50s and HIV positive. I have private insurance, which isn't cheap, by the way. But recently when visiting my doctor for my quarterly blood work and checkup, my doctor tells me he only has 15 minutes to spend with me. I feel rushed and processed like a cattle. Is this the norm? P.S. My doctor wants to know why my blood pressure is high. Signed, Mad on Martel. Phil, I think you're probably best to answer this question.
So, yes.
Is that the norm that you guys are under to see X amount of patients an hour, day, week, month?
Yeah, so remember that, I mean, and patients don't like to hear this, but part of this is, you're running a business. And you have to
like Jesus.
And you have to cover overhead. And as time goes by, insurance companies pay doctors less and less. If you look at it over the years, they're paying you less to do the same work. So how do you compensate for that? You have to see more patients in the time allotted to you.
Do you feel pressured?
Yes.
Do you feel...
I have to cover my overhead and make a living.
I know, but what about the person that comes in that may have... anal warts and toenail fungus that you need to go over. And that's a really bad example, but...
Well, no, it's not, because anal warts can take a minute to treat. so
and it's something you don't want to talk about. Or no one will confess they have.
So, I personally always try to give people as much time as they need, but I am trying to run on time. I often run behind because that's me.
Yeah, you run behind. I can hardly believe that. But you draw the line when you realize this patient really needs some extra talking to, or there's something going on with them, him or her, or you got to say, I got to take the 15 minutes and throw it out, and you've got to spend more time.
Exactly. Yeah, and because sometimes people need extra time.
Now, will the insurance company ask you why you haven't seen that as many patients that day? Do you have to answer to them?
Insurance companies don't care how many patients you see.
They don't?
No. They don't. They only care that what you're billing for is appropriate for what you did. So your documentation has to be correct. It has to meet what your level of billing is.
Moving on. This is for Phillip and Heather. I have been with my primary care physician for 10 years. I've recently become disabled and lost my job. I can't afford Cobra and have ended up having to go on Medi-Cal. I had an issue when I called my doctor's office to make an appointment and was turned away because they did not accept Medi-Cal. To Heather, this is a two-part question, is this legal? And to Phillip, is this ethical, and how would you handle your patient? This is a really good question. If you want to look at it, both of you, just for...
Legally, it's legal.
Yeah. Legally, it's legal.
No doctor has to ever take any specific insurance company. And Medi-Cal is probably...
what I'm thinking is this person was with a doctor, they lost everything, they had to go on Medi-Cal, and now, boom, that doctor's... they can't take them anymore.
They don't have to.
So what should a person do? If they do lose their insurance, should they notify their primary care physician right away and then see if they're going to be taking Medi-Cal? I mean, because you're talking about medicine here. You're talking about people that can be very sick, and now you're sick, and it's like you don't know where to go.
The emergency room, unfortunately, is the answer.
Is it?
The doctors either take Medi-Cal or they don't.
So what you're saying is go jump off a cliff. No,
most doctors aren't.
Joking.
Most doctors who don't take Medi-Cal aren't going to take Medi-Cal for one person. Either you take it
Either
or
they
you don't.
do or they don't.
Is that a
Philip?
Yeah.
Any wise words of wisdom here to recommend for this person?
The issue about is it ethical is a debate. Really, is it ethical? I personally think for me, if I was taking care of somebody for 10 years and they fell on hard times, I would try to accommodate them as best I can and would do everything I could not to force them to go and seek care elsewhere. But
It's gotta be.
But if you're not contracted with Medi-Cal, you can't see them actually.
Wow. Can you Philip? Can you see anybody that does not have any insurance at all?
You can see whoever you like. Yeah,
You can see whoever you like.
yeah.
But,
I mean, people who want to come in and pay cash, it happens.
they can pay.
Yeah, you can charge
So you
cash.
would have a cash patient up front. But what if you agree to see them, but what their treatment goes beyond what that office visit when you told them up front? How do you handle that?
I think it's like anything, right? You charge for the service that you provide.
Yeah. Have you ever had that?
Sure.
Sure. Yeah, you've had that. It's a
Yeah.
tough situation.
No, it is because
It's a very tough situation.
Well, it's tough because you're dealing.
Because you
with,
took an oath, right?
That's the point.
And you
You're
took an
dealing
oath
with
too, Heather,
people's
right?
I
lives.
did.
You're dealing with people's lives, and
You're
you
dealing
need
right.
to
It's
have
serious
a
matters.
sensitivity
It's
to
very
that.
serious. Very serious.
Yeah.
All right, we're going to move on. And I think this next question here is for Heather. I'll let you read it. So I think that's a good question.
This is a good question.
Speak up, please. Dear.
I had a perfectly good PPO policy from Blue Cross.
PPO means
Preferred provider. I don't know what the O stands for, actually.
organization.
Organization.
Okay, we'll just call
It
it.
means you get to pick your own doctor for the most part. Is what
Pick
it
your
means.
nose, right? Okay.
From Blue Cross for over a decade. After Affordable Health Plan, Blue Cross told me they had to cancel my policy and reissue one. My premiums doubled, and I am now getting doctor and lab bills for which the insurance is not paying the total amounts. Why did this happen, and what can I do about it? We could discuss for 30 days probably how this happened,
Or longer.
because that's how long the negotiations went on in Congress. Bottom line was the Affordable Care Act.
ACA, Affordable Care Act,
Correct.
right? Or AKA Obamacare.
Obamacare goes into effect after a long negotiation. And part of the negotiation was if everyone was going to get insurance, what was it going to have to cover? Things went in, things went out, and you get a bill that I believe is about a foot tall on its own. So you probably could ask the drafters today how much it covers for lab bills, and they don't know. And so what happened was, it's true, Blue Cross had to cancel all of their policies to end up with Affordable Care Act compliant policies. There are two types of Affordable Care Act compliant policies in
Two.
California. Blue
This
Cross.
is very important. There's two types.
There's various kinds within those two types, but there are two types. There is Blue Cross PPO policies that are now Affordable Care Act compliant. They shouldn't be much more than what you were paying in premiums, but what they will not cover nearly as much are things like lab bills. Back to what I was saying earlier, I guess the last tape. Preventative medicine is what Affordable Care Act covers the most. So now you're not having to pay for mammograms or yearly checkups at all. Those are zeroed out. But you may pay a whole lot more for an MRI than you used to. That's one kind of Affordable Care Act
You realize
compliant.
you're talking like stereo instructions, but go ahead. Yeah, this is very difficult.
I'm trying to keep it as
Trying to keep it simple
simple
as you
as
can. Yeah.
The other is called Covered California.
Covered California.
And those are what you hear about exchanges and you're
Right.
buying into.
You see, I saw a lot of advertisement for Covered California.
So those policies are inexpensive and they really don't cover very much. They really are emergency
I
policies.
think that this person here probably has that coverage. This
Right.
Covered California, they had an incident and got whammied.
Exactly.
With the bill.
And a lot less doctors take Covered California Blue Cross policies than take a Blue Cross PPO policy.
A lot less doctors take Covered California policies versus
A regular Blue Cross. I mean, so much so they had to, the state, because it's the state policies, these are exchange policies, had to force the UC health system to take covered California policies. Now that's the government telling the government to do something. I mean, that's how bad those covered California.
How do you go to work every day and keep this all straight?
So,
it's got to be complicated.
It's very complicated. And the Affordable Care Act is incredibly a complicated act. They passed it through because they thought we had to start somewhere. It's a start somewhere bill.
Kind of like when they started taking out for Social Security.
Exactly.
My grandparents owned a printing business, and I remember my grandmother telling me that they didn't know what to do with the withholding taxes. Philip, in your course of your professional, how have you come across a lot of these problems with between the toss that, Heather? There you go. Yeah, there you go. Anything you want to add to that?
No, I agree with what Heather's saying. Is that
Easy answer.
yes, it is the easy answer. They're different.
I agree with Heather.
There are different tiers. There are different tiers of,
Yeah.
of health insurance, and in a lot of ways, depending on what you pay for, that's what you get.
Yeah.
But in speaking to the question, whatever health insurance policy you buy is expensive, and often, it's limited what you get for it, but it's better than nothing.
Do you think this is going to filter out eventually as years go by? Kind of like, will it get a norm of all this? Will it get better? I think is what I'm asking.
We hope.
We hope.
We all hope.
I mean, just what Heather said, this is a starting point. Hopefully,
It's a jumping
we go
off
to
point, yeah.
fine-tune it and iron out the kinks and the glitches as time goes by. This is
What do you feel is one of the biggest problems with it? As
with
of
the
now?
Affordable Care
Yeah, with
Act,
the ACA.
is that it's so confusing. It has got so many ramifications and levels and plans, so many different plans that provide people with different benefits. It's hard for people to understand what they're getting.
And we have to realize in California, a lot of the really great parts of the Affordable Care Act were already here. For instance, mammograms were legislated in 1977, had to be covered. There were 6 states in the United States that you did not have to cover a mammogram, but you had to cover a prostate screening. That sex discrimination still existed in health insurance. All of those sorts of things went away. Vaccines have to be covered now. California had mandated that a long time ago. So a lot of the real easy benefits of the Affordable Care Act never showed up in California because we already had those benefits. We have exchanges, whether they're working or not is debatable. A lot of states don't even have them, and there's all kinds of problems in those states. Surprising, one of the states that's been a very big success is Kentucky, which you would not have expected maybe
Fried
based.
chicken. When you say Kentucky, I think of fried chicken. Why is that?
Their government got behind exchanges, and it's not a huge state. California's biggest problem is a lot of people, a lot of exchanges, so it's a hard thing to.
It's a harder thing to
But
knock out.
small rural states who bought into the exchanges, it's actually working. And Kentucky went with a Republican governor, bought into it, which was a
And
surprise.
you said the word Republican with a little bit of an undertone there.
Yes, well, okay.
Well, okay, that's okay. We
All
like
I have to
Republicans.
say is my son's.
I've had sex with a few.
I say my son's middle name was his initials were gonna be GW, and we added a different middle, so it's GJW.
I think that's a good idea.
Yeah.
So, well, do you think overall it's going to be better for Americans in the long run, the ACA?
I hope so, other than the fact that the challenges to it aren't to the actual problems. The challenges are to the areas that are working. If we could move past maybe politics and actually look at healthcare.
Kind of like the space shuttle.
I mean, it is better for a lot of people because you have to remember a lot of people never had access to any care.
Well,
Right,
they had no access to any
there
care
are a
at
lot
all.
of people that now have access to healthcare, and in the richest country in the world, people should have access to healthcare.
You just heard that from a doctor. Moving on. This question is for Phillip. Would you rather have between your patient a government entity like Medicare or private insurance? I think we kind of went over this, but
Yeah,
how about you look at the question in case you want to look at it while you talk, then toss it.
I want to say that in general, Medicare is easier to work with than private insurance companies because Medicare has fixed guidelines. They stick to their guidelines. This is how it works. This is what happens. Private insurance companies can make their own rules, and often they make their own rules based on what Medicare is doing. That's sort of the acceptable minimum. The other thing is, from my personal point of view, one hopes that the government is in this for the people.
Isn't that what government's all about?
Exactly, to serve the people. And private insurance companies...
Police are protect and serve, but if you look what's going on, it's not really happening, is it? No, I know. That's
another whole show.
Yeah.
But private insurance companies are, they're there for profit. So different motivations, I guess. I think that
If
the government...
If I was to come to you and say, I'm about to get insurance, I've never had insurance before, or I'm about to change insurance, would there be a particular company that you would say, hey, go with this one? Or would that depend on what my health needs were?
Well, yes, there is. I'm not about to say to you which company I would go with or tell you to go with.
You don't want to go there, huh?
No, I don't. But I will say that there are certainly certain companies that provide better coverage than other companies.
If I was to be talking to you in private, would you?
Yes, I would.
In private, okay.
The other thing
you wouldn't want to say public because would you get slammed by the insurance company for not saying one or the other?
No, I think it's a short answer for a broad question. So it's not a quick simple answer. You should go with them, but there are definite advantages to certain companies.
Heather,
and policies.
you wanted to add something?
I did. If your doctor is in network with one carrier and the doctor you want to see is in network with that carrier, that's probably the carrier you want. Your doctor relationship should probably, if you have especially if an ongoing illness, your doctor
a pre-existing condition.
Exactly. Well, that's out. That's out under the Affordable Care Act. Who your doctor contracts with may be the most important decision in your
entire life. Yeah, it's not easy. I think you got to go by what's going on in your life, how old you are, what you've been doing, and I mean, you've heard people scream about it. You've heard people praise about it. There you go. I like that, Phillip. Oh, we've got another question here. What is this for? Heather, I'll let you read it. It's for you.
Okay.
Read loud. Speak up, dear.
I'm a 23-year-old male. Not that.
No.
I recently tested positive for HIV. I'm not using any HIV drugs as of yet. Who else now knows this information, and how secure is my health insurance?
That's a good question.
That's a
very good question. What do we do about that?
Nobody else should know it other than your doctor.
Well, you say no one else should know that. Does this go into a central computer?
It does.
Like Dale Gribble and Family King of the Hill would be really upset about.
So there are central computers now with health insurance information, which in a lot of situations is life-saving. If you've been in an accident and you can't talk, the fact that now so much of our medical records are readily available online helps those EMTs and those paramedics and those emergency room people know you're allergic.
Especially if you're allergic to lobster.
Or allergic to sulfa.
I almost said sulfa. I'm allergic to sulfa. So.
Or lidocaine. That's a reason, for kids in sports being allergic to lidocaine.
What is lidocaine?
It's the thing they shoot you
local
with
anesthetic.
But if you've had stitches or something, it's what they use. And if a kid's allergic to it,
so
it's really important to know it fast.
Yeah.
So in that sense, the trying to create national health banks is really important. The downside is, how do you secure it so that only the doctor who needs to know when they need to know it.
Well, I think what this person might be saying, could they be discriminated against, or it's
your employee,
it's almost like saying, I'm a woman, I had an abortion in the past. Who now knows about this? That's pretty personal information.
Only your primary physician or whoever at that moment is treating you should be able to access your health records. There are both state and federal regulations that are pretty tight on keeping things secure. Hackers happen. I mean, there's just no way around it. Your medical records are online. Somebody can get to them. you can put up as many statutes as you want, and someone's going to go around
If
it.
somebody, is there any way of knowing that your medical records have been exposed to people you don't want it to?
Well, you could get the letter from your health insurance company, or from your, or if you're at Kaiser, you'll get a letter saying, "We have lost this flash
Information,
drive that
right.
has 20,000 records
Okay.
on it.
And
We
you-
are very sorry."
Here's a question of my own. I live in California, obviously. Say I have to travel, or I'm on vacation and holiday to Florida. And there you go. There you go, girl. Okay, I'm on vacation in Florida, and I have to call my doctor. I feel bronchitis coming on, or a strep throat, or something like that, where he's got to call a prescription for me. Now I go to a pharmacy in Florida. Okay, does that pharmacy know everything about my past that by bringing up a record?
They shouldn't. They shouldn't.
They shouldn't.
They shouldn't, because they don't need to know it. That doesn't mean they can't figure out a way to access it. That's why I said what they're supposed to do and what they do are two very different things in a world where everything's online.
Well, that could be pretty scary. That could be that. I have a brother that lives in Florida. He went to Walmart to get a prescription. The pharmacist at Walmart, and this is in Venice, Florida, everybody. And the pharmacist said to the guy there, "I see you use our pharmacy in San Diego, California. There are several." My name is Joel. I go by Joel Coop. My last name is Carissimo. Okay, there's not many of us, but I've got some cousins in San Diego. And they said to my brother, "Oh, I see you use our pharmacy in San Diego." My brother calls me and says, "Why are you going to San Diego for your pills? Okay, are you doing something funny?" And I said, "Define funny." All right, no, and it turned into a fight with my family, and I'm like, "What are you talking about?" All right, and then I went on Facebook, of course, and I contacted a cousin. She goes, "Yeah, I use this." Why did that pharmacy tell my brother, "Oh, I see you"? Why did he even bring that up, that I use you in San Diego?
They shouldn't.
They shouldn't.
They violated.
I was
some
pretty
laws.
upset. I was very upset, because it was like my mother even got on the phone with me. May she rest in peace. And saying like, "What's going on?" Like, I'm like, "Mom, what are you talking about? I don't go to. Why would I go to San Diego?" I said, "I have a doctor here. I go right around the corner to get my drug. What is going on? This is getting crazy."
It's a problem on privacy, but you can see the benefit, right? You're on vacation in Florida, you need a drug,
Right.
and because Walmart's nationwide, they go into your records and they're like, "Oh yes, here it is." So it's a very win-win-lose situation.
Well, yeah, and from a medical point of view, I got to say to you that if you get a prescription in another state, and the pharmacy can actually see all the medications you're taking, there's value in that, because there may be a contraindication. There may be a drug interaction. And the doctor that you saw, let's say you saw a doctor in Florida who didn't ask you everything you're taking, the pharmacy may alert you to the fact, "Oh, you shouldn't
We
do
have a
these
few
two."
seconds left. What's the most important thing you think our viewers need to know about the Affordable Care Act? Heather.
To ask a lot of questions, both when you're applying for your insurance and of your doctor as to what insurance they're going to take.
Phillip.
I don't have much more to add to that.
Yeah,
I mean,
much more to
it's-
add to that?
No, I mean, you need to get informed.
You need to be informed.
Yeah, and it's complicated.
You need a navigator.
You do.
Say goodbye.
Bye.
Bye. Where's Hollywood? God bless.